So coming next, so the answer over here is iris. Coming next, sweat gland discuss is the adrenal acetylcholine. You have to keep that in mind. Thrombi from deep veins of legs mostly occlude which vessel? Now popliteal vein. DVT is most commonly seen in popliteal. But which form of DVT causes pulmonary embolism? That is femoral. So the most common cause of DVT is popliteal vein DVT. Most common cause of DVT that gives rise to pulmonary embolism is femoral vein DVT. But that is the clear-cut thing. Deep vein thrombus lodge in. Now they are talking about lodge. If the question is first go, पहले किधर जाती है? तो पहले जाती है inferior vena cava में. पहले जाती है inferior vena cava में. फिर कहाँ जाती है? फिर right heart में जाती है. To the right heart. From the right heart goes to the right ventricle. From the right ventricle it goes to the pulmonary trunk and pulmonary artery. So over here lodging is first go to IVC, but if word is large then pulmonary artery. Woman blood group O negative, could be a donor, could be recipient, RBC like antigen, all are the right option, but over here I will pick the C because the RBC has no antigen, that's why it is called O negative. O negative means the RBC has no antigen, no RH antigen and no ABO antigen. This is actually 0. It was called 0 because it was having no antigen. But to compare it with the other blood group A and B, it looks very awkward to say 0 blood group, it is O blood. So they gave the word O blood group. 0 means no antigen at all, neither A nor B. Coming next, which of the following is associated with the neonate? Now this is very important. In neonate, the diameter of the orbit, it is equal to the diameter of the maxilla plus mandible. So M plus M is equal to orbit diameter. I am talking about the neonate. What happens in the adult? The diameter of the orbit, it is 1/3 of the maxilla plus mandible length. So they are talking about over here the neonate. Option B, orbit diameter greater than maxillary length, that is the right answer. Option C, orbit diameter equal to the mandible. No, orbit diameter is more than the mandible, because you see the formula, the orbit diameter is equal to the combination of both. So it is more than maxilla and it is more than mandible. But in adult, what happens? The reverse occurs. The growth of maxilla and mandible is high and the growth of the orbit is low. So what happens? The maxilla and mandible, their size is more as compared to the orbit. So there is adult formula. The orbit diameter is then become equal to 1/3 of the maxilla plus mandible. So over here the B option is right. Coming next, single most potent factor for secretion of insulin from pancreatic beta cell in human is glucose. That is the glucose. There is another MCQ. You are giving a person oral glucose and IV glucose. Which will secrete insulin more? The answer is oral. Why? Because of GLP-1, glucagon-like peptide 1 hormone released from the gut, and that release from the gut due to stimulation by glucose, and it causes release of insulin. Hemorrhagic infarcts occur typically. Now hemorrhagic infarct or the red infarcts occur in those organs which are having dual blood supply, typically seen in the lung, liver and the GIT. The red infarcts, the pale infarcts are seen usually in the organ which are having single blood supply or having end organ. Over here the answer is pulmonary thromboembolism is the right answer. Well, liver can cause a red infarct, but usually that is not due to hypotension. The first thing you have to choose is pulmonary embolism. If that is not present, then liver. Which of the following is associated with the nucleolus? Now nucleolus has no limiting membrane. Philadelphia chromosome cml, 9 to 22 translocation. The relation of phrenic nerve to subclavian vessel and scalene muscle in neck. In neck it lies anterior to scalene, and in thorax what is the relation of phrenic nerve to subclavian? Now if you see, the question is not clear. They're talking about subclavian artery or subclavian vein. If the question says artery, if the question says subclavian artery, then the phrenic nerve goes in front of the second part of subclavian artery. Suppose this is subclavian artery and this is the second part of subclavian artery, so it goes at the front of subclavian artery. If the question says subclavian vein, then it runs behind subclavian veins. You have to keep this thing in mind. Artery in the front. If asked about subclavian artery, then the phrenic nerve goes anterior to subclavian artery, means subclavian artery is posterior to phrenic nerve. If asked about the vein, then it runs behind the subclavian vein, means the subclavian vein is anterior to the phrenic nerve. So anterior and posterior depends upon subclavian. Over here neither subclavian artery is mentioned nor vein, so you have to keep this thing in mind. Virus involved in AIDS having Kaposi sarcoma, that is human herpes virus 8, that is the statement. Now toxoplasmosis is already discussed. It is a protozoa, it is not helminth, and if protozoa is not an option, then the option is C. Inferior rectal artery is a branch of, now they are confusing you, superior rectal artery, middle rectal artery, inferior rectal artery. The other name for rectal artery is hemorrhoidal artery, another name is anorectal artery, so they will confuse you. Superior, middle and inferior. Superior rectal artery is the branch of inferior mesenteric artery, that is the continuation of the inferior mesenteric artery. Middle rectal artery, it is a branch of anterior branches of internal iliac artery. This is another MCQ. These are the MCQ which are repeated again and again. And inferior rectal artery is a branch of internal pudendal artery. It is internal pudendal artery, so you have to keep this thing in mind. And which of the artery lies in the true pelvis? The answer is middle rectal artery, because it is a branch of internal iliac artery. It is a branch of internal iliac artery, and the branches of internal iliac artery lies in the true pelvis, apart from 4 to 5 exception, which I have shared on my page, so you can watch from there. Diphyllobothrum latum form, so B12 deficiency, it causes B12 deficiency. Biological factor involved in the cervical carcinoma, simple MCQ, human papillomavirus. Infarction posterior 1/3. Now this is very important. This is not RCA, this is posterior descending coronary artery, because in majority of the cases it is the branch of the right coronary artery. So if it is not there, then the right coronary artery, because if the posterior descending artery is arising from the left coronary artery, even then it supplies the posterior 1/3 of the septum. Posterior 1/3 of the septum. So the septum, in case of left dominance, is supplied by right coronary artery or left. It is completely supplied by the left coronary artery then. So coming next, which of the following is associated with the skeletal muscle? Now the var gaze is also related to the skeletal muscle, and curare is also related to skeletal muscle, but in var gaze you are having other symptoms as well. This is not only to the skeletal muscle. You are having the parasympathomimetic effect, you are having organophosphate poisoning, you are having meiosis, you are having rhinorrhea, you are having increased salivation, increased bronchial secretion, bronchospasm, bradycardia, you are having psychosis, you are having urinary incontinence. So there are autonomic features as well as skeletal somatic features, but curare can cause only the skeletal muscle, that acetylcholine in the skeletal muscle. So if there is not an option, then I of course choose the A option. In majority of the cases, these are the poor recalls, so you have not to rely solely on this MCQ and not to occupy and not to program your subconscious mind with the wrong answer. Just open your mind. It can be C, it can be A, depends upon the scenario. You have to look for the other options as well. If A is not in the option, then B is the option. Most of the time what happens that majority of the patient do not remember the question recalls, or there is a mixing. There may be two MCQs in the same paper. In one MCQ option A was there, in another option C was there. So what happens that during recalling, the different option and the different MCQ, they are mixed up. Coming next, diphtheria toxin, mainly that action on the heart. Which of the following is associated with the capillary heart? Now there is another MCQ I'm seeing again and again, and a lot of times the people are picking the wrong option. A patient is having edema. The main reason for edema is number 1, increased hydrostatic pressure. This is the option A, or option B, sodium and water retention. Now if you see to this question, both are right, but this is a poor recall. What happens? Pulmonary edema. The right MCQ is pulmonary edema in case of CCF. What is the cause? Now, increased hydrostatic pressure is the answer. Increased hydrostatic pressure is the answer. Another scenario, a patient is having pedal edema. A patient is having pedal edema, but serum albumin is normal. Pedal edema bilateral, serum albumin is normal, and the cardiac function is normal, echo is normal. Cardiac function is normal, echo is normal, liver function is normal. So what is the cause? That is the sodium and water retention. Then the answer is sodium and water retention. Same MCQ, a patient is having pedal edema, but he is in congestive heart failure. The answer is increased hydrostatic pressure, because the back pressure is increased, and it causes what? Hydrostatic pressure increase. It causes what? Increase in hydrostatic pressure. Now there is another MCQ. A patient is having generalized edema, but albumin is low. The cause for edema is decrease in oncotic pressure. Decrease in oncotic pressure. There is another MCQ. You give a patient 10 liters of normal saline. Now the patient is having edema. What is the cause for edema? Increase in hydrostatic pressure inside the vessel, that is capillary. Increase in hydrostatic pressure of the capillary. There is another MCQ. A patient is having lymphatic obstruction in edema. What is the cause of edema? Increase in hydrostatic pressure inside the vessel, or increase in hydrostatic pressure inside the interstitium. So if there is point number 3, increase in oncotic pressure. Increase in oncotic pressure inside the tissue. Now explaining this thing. If you are having lymphatics, so the lymphatics drain what? It drains proteins. Whatever the proteins or whatever the fluid, it drains the extra fluid. So if there is obstruction, what happened? The extra fluid, it cannot be drained. So what happened? There is accumulation of fluid. When there is accumulation of fluid, it causes what? Edema. It causes edema. So the accumulation of fluid causes what? Increase in hydrostatic pressure. So in lymphatic obstruction, the increase in hydrostatic pressure is actually responsible for edema. But increase in hydrostatic pressure inside the lymphatics first, so they cause the leakage of fluid from that, or the fluid cannot go because there is high pressure in the lymphatic, so they accumulate from the back. When they accumulate from the back, so the increase in hydrostatic pressure inside the interstitial fluid develops. So this is a bit difficult, but you have to focus on the things, and you have to open your mind. So another MCQ, a patient is having pedal edema, and the patient is hypertensive and deranged renal function. The cause is sodium and water retention. If asked about the mechanism is increased hydrostatic pressure. but focus on scenario, focus on the statement. With the following is associated with period hydrostatic pressure. Now pressure increases in the heart failure. Discussed. Local anesthetic with highest cardiotoxicity, but PVKN most cardiotoxic. Inferior NICA option including that it commences means start, so it starts at the level of L5. What happens at L4? The division of abdominal aorta into two branches occur at the level of L4. Base of the bladder posterior surface. With the following is associated with aplasia, that is failure of growth. So what is the difference between agenesis and aplasia? In aplasia you are having primordium tissue. In agenesis you are having no primordium tissue. No primordium tissue. There is primordium tissue, but there is failure of growth. Failure of growth. So the difference between agenesis and aplasia is primordial tissues. If it is there, then it is aplasia because the growth was arrested. If it is not there, then this is agenesis. Important difference between benign and malignant. So invasion is a very important thing. Invasion or metastasis. Invasion or metastasis. Staph aureus is a, well, I have declared it in my second video or third video regarding the ischia pink that it is catalase positive and it is coagulase positive. The strep pneumoniae is catalase negative, and the other two organisms related to coagulase negative are Staphylococcus epidermidis and Staphylococcus saprophyticus. Well, there is another MCQ that is coming to my mind. In a sexually active woman, most common cause of UTI is, well, the option they have given to you is Staphylococcus saprophyticus. The reference is USMLE. Well, there is MCQ. Most common cause of UTI is of course E. coli, but if they ask about the sexually active, then this is Staphylococcus saprophyticus. Women taking estrogen, long-term effects are hepatic adenoma. If that is not in the option, then thromboembolism. DVT, then thromboembolism. DVT. Is it exogenous estrogen or endogenous estrogen that has cardioprotective function? The answer is endogenous estrogen that has got cardioprotective function. Exogenous estrogen causes thromboembolism. What is the following is associated with pulmonary congestion? Cardiac. If there is CCF, blood cannot leave it, so it accumulates in the pulmonary vessels. Glucose maximum absorption occurs in proximal convoluted tubule. Glucose in amino acid in intestinal cells facilitated diffusion. Now regarding the local anesthetic or oxygen or carbon dioxide, people are asking how they cross the placenta or respiratory membrane. Is it simple diffusion or passive diffusion? So the diffusion is passive. The diffusion is passive. So the answer is, in that condition is simple diffusion. So we are having simple versus facilitated. So if they talk about the glucose or the amino acid, then this is facilitated diffusion. But if they talk about the gases or local anesthetic, then that is simple diffusion. Increase karyokinesis index in young people indicates what? So this is a statement and this is the right statement. One case was based on the normal distribution curve, and the question was asked how many percent fall in the first standard deviation difference. So the description over here is the right. In the first, if the standard deviation is the first standard deviation, then this is 68.5. If second, 95.4. If third, 99.7. So this is the right sequence. The germ cells from yolk sac migrate into gonadal ridge, and so the germ cell arise from endoderm of the yolk sac. If that is not in the option, then the wall of the yolk sac. So the description of question number 84 in this book is right. Whatever is written, it is right. That is, third week the primordial germ cell reside in the yolk sac. Fourth week migrate along the dorsal mesentery to the hindgut. Now you have to remember each word through the dorsal mesentery. because there is another MCQ that it travels through which pathway? Through the dorsal mesentery, and then to the hind gut. 5th week arrive at the primordial gonads. At 5th week it arrive at primordial gonad, and 6th week it invade the gonad. What is the correct about thyroid gland? Supplied by 3 paired arteries? No, there are 2 paired arteries. Surrounded by prevertebral fascia, isthmus attached to cricoid venous drainage. Now that is the right answer. Option D, venous drainage in the brachiocephalic vein and the internal jugular vein. So you are having the 3 paired veins: the superior thyroid vein, the middle thyroid vein, and the inferior thyroid vein. And they all of the 3 they drain into brachiocephalic and internal jugular vein. So that is the right answer. What is correct about human kidney? Now the renal corpuscles are only found in the renal cortex. If it is the renal cortex and this is the renal medulla, so you will see the renal corpuscle only over here. Renal corpuscle mean Bowman capsule and glomerulus. So they are reside in that. What is true about HCG? So the answer over here is can be detected in the serum on the 9th day of ovulation. That is the right answer. Now regarding HCG, this is important for gynae people, so I think I should explain this in detail. Now you can see this is the description of the beta HCG. Its qualitative test is less sensitive, more sensitive is quantitative. It may be detected in urine. Now you have to focus on urine and serum. Urine or serum. In urine, 14 days after fertilization, that is 2 weeks. But if they ask about serum, in the serum that is 6 to 9 days on average, and in our question that was 9 days. So this is the right option. So most sensitive is serum beta HCG. Most sensitive is quantitative HCG. Is it beta or alpha? It is beta HCG. Normal pregnancy beta HCG concentration doubles every 2.5 days in early pregnancy for the first 4 weeks. This is important. Doubles every 2.5 days for the first 4 weeks. Now the peak is reached at the 10 weeks of gestation. The peak concentration is at the 10 weeks of gestation. In the peak value you can see 100,000. That is the peak value. Now this is very important. During second trimester the value goes down. In first trimester it goes up, in second it goes down, and during the third trimester it remain constant. A beta HCG level of 1500 to 2000 pregnancy is visible with transvaginal ultrasound. So if a beta HCG level of 1500 to 2000, so you can see it transvaginal ultrasound. If beta HCG is less than 1000, repeat beta HCG and transvaginal ultrasound in 2 to 3 days. Now this is very important. There are MCQs regarding the ectopic pregnancy. So a beta HCG of 1500 to 2000 pregnancy is visible with transvaginal ultrasound. If beta HCG is less than 1000, repeat the beta HCG and transvaginal ultrasound in 2 to 3 days. Low levels or slow rise may be seen in ectopic pregnancy, abortion, and Edward syndrome. So coming toward the back. So discussed in details about the BCG. Over here you can see maximum level. This is 18 week. No, this is the 10th week. The option C, secondary rise during late third trimester, and third trimester there is no rise. Rise is 4 times every 48 week. No, right? Rise is 2 times, doubles. Secondary fall during last 2 weeks of pregnancy. No, that is the second trimester. So the answer over here is A. A female patient comes in your office and start talking in seductive way. Most important step from you should be call the nurse. Call the nurse. And there is another MCQ. You are going to examine a female. You have to examine it in the presence of a nurse or another female attendant. Well, this is the rule for males. For females, she can examine. So over here you can call the nurse, and in front of the nurse she cannot seduce you. So the type of sacroiliac giant is synovial giant. Protein in mitochondria synthesized by ribosome, that is 70S. Fibroblast function and wound healing, that is extracellular amorphous substance. But the fibrocartilage, if asked, then that is rich in collagen. So the fibrocartilage and the fibroblast. Most common site of gram-negative infection causing septicemia is urinary tract. If heart rate doubles during exercise, then cardiac cycle will complete in. Now if you are increasing the heart rate, the time duration for the cardiac cycle decreases. So the normal cardiac cycle is 0.8. If it is double, so it will decrease by 2. So 0.8 divided by 2 is equal to 0.4. Well, there is another MCQ I already discussed in my previous video. A patient for 75 heart rate, a patient is having I do not remember the exact wording, but that was 0.1 second. If you for the heart rate of 275, what will be the duration of this? So do you multiply both sides by 3? I think that was 0.3 or something, so that becomes 0.9. So the answer was 0.9. So you have to equalize both sides. So that's all for today. Thank for watching the video. Well, this video I'm just giving you just an overview, and those people who are not comfortable with this video, so they are not supposed to watch it. भाई ना देखो, आपको किसने कहा कि देखो, ना देखो. Thank you.